hand still has an arterial pulse.
His hand is a cesspool, and the crap is spreading.
He loses that hand, he loses his job.
You sure I need to do this?
Yes.
What? He's actually gonna lose his hand? Okay, let's think about this. Very excited to be reacting to House MD Season 2, Episode 3, Humpty Dumpty. On this channel, we are reacting to all 177 House episodes, and this will be episode 52. Let's see if I can get the diagnosis before House does as a doctor working in London.
My asthma is very bad today.
Your two little fingers are darker than the others.
Wow, Cuddy thought he was faking his symptoms even though he was guzzling that asthma pump like he was fueling a diesel engine. Asthma is a serious condition and there are 1,200 deaths from it in London alone each year, with 2/3 of them being preventable. One major red flag to us is people using their blue reliever inhaler too much. If you need to puff it more than 3 times per week, then your asthma is not well controlled. We had a very interesting case recently of a patient in my surgery who was seen by a former trainee. He was a 21-year-old guy with asthma who hadn't been seen in the clinic for a while. My predecessor saw the medication request and thought to issue the inhaler, but send the patient a message to come in to see one of us for an appointment. The patient didn't do that, and 1 month later, he had been unfortunately found passed away at home due to poorly controlled asthma. My predecessor was called in by the coroner, who opened an inquest to try and find out why this patient has died. He was called into question for issuing the medication without a recent review, saying that it wasn't safe to do so and he should have rejected the prescription. I was very surprised to hear that at first, because surely you would be under even more scrutiny since you'd be depriving a patient of meds they need, right? But not quite. The rationale is that if you don't prescribe it, then the patient will be forced to come in so that you can review them properly and make sure they get the right preventive treatment and not just the reliever. That could have prevented this patient's death potentially. In medicine, you have to be on the ball all the time, as one little slip like this could cost you your license and, more importantly, a patient their life. Speaking of which, Cuddy forced this poor guy onto her roof where he couldn't breathe, and now she's fighting for his life and her own career. She said he had dark fingers, which could mean Raynaud's, which is causing spasm of the arteries of the finger, so maybe there's a further underlying autoimmune condition that's linked, like Scleroderma, to consider. Could also be a clot related to something like endocarditis, an infection on one of the heart valves throwing off clots peripherally. Let's get more clues.
Cervical MRI, workup for DIC, and start him on a heparin drip.
I think you're not a lawyer. Don't go in there.
Some pretty nasty scars there.
Interesting, so our new hospital lawyer, who also happens to be House's ex, had to save Cuddy from going in there and claiming liability. But this guy works as a janitor for 6 nights a week, has a full family to support, and won't get paid if he's not at work. Then you have Cuddy, who's a hospital boss with a steady income, who caused this. She wants to help, but she can't because of the litigation culture that is present in the US. Now, in the UK, doctor's indemnity cover is generally included with our training jobs, and after that might be the equivalent of $1,250 a year for family medicine. In the US, family physicians can pay $10,000 for malpractice insurance, and some surgeons can pay between $1 and $3 million per year. Of course, they'll be earning more than that to justify that cost, but it's still a hefty sum. So the team have some ideas of what this worsening lack of blood flow could be. House thinks it's a clotting problem called DIC. He also thought it could be some kind of nerve impingement of the neck that caused it. Looking at his hand, there are a few things I'd want to know. Is it warm? Can he move it freely? Is his power reduced? How painful is it? These things would help me to narrow down House's differentials, if any of them were right, which I doubt. One thing after trauma, especially since he seems to be in a lot of pain, is could this be compartment syndrome? Maybe he has had a bleed in the forearm and the pressure is rising in that compartment, leading to the artery becoming occluded. is something known as compartment syndrome. At the very least, I would want an x-ray of that forearm and to keep a very close eye on how his symptoms progress. If it is compartment syndrome, then they would need to make a big cut in the forearm to relieve the pressure. They should make Cuddy do it. Maybe I'm being a bit too harsh. Am I being too harsh? Answers down below.
Where's Dr. Cuddy?
You've got a third finger turning dark.
We need something stronger than heparin. Inactivated protein C.
You know, if I try to scheme like this, you get that nasty, wrinkly face and screech like a hyena.
Screech like a hyena! Nice that House has now learned to flirt like a 3rd grade boy. So this patient's clotting tests were off with a prolonged prothrombin time, deranged fibrin degradation products, and therefore they diagnosed a mild case of a condition called disseminated intravascular coagulation. You see, that doesn't help us much at all because there are about as many causes of DIC as Kardashian surgeries. Sepsis, liver cirrhosis, pancreatitis, toxins like snake venom, or even cancer can lead to it. Maybe we can use the title to narrow it down. Humpty Dumpty sat on a wall. Now, I vaguely remember from a nursery rhyme that Humpty Dumpty was an egg. So maybe there is a double meaning. Maybe he ate an egg that was sitting outside for too long, or got salmonella or another foodborne illness, and now he's reacting to it with this condition. Would definitely fit the title, but he would also have diarrhea and vomiting, which he doesn't have. So that doesn't feel like it's it yet. Now, what about this human activated protein C that Cuddy wants to use? Well, it has been studied for this context and has been shown to work in rats. A quick recap of the problem in DIC: there is initially massive amounts of clotting, which then consumes all clotting factors and subsequently leads to very thin blood, which is prone to bleed. Activated protein C stops clots forming strongly and breaks down a molecule called fibrin, which is like a scaffold that helps keep the clot together. So they may be able to help this initial phase, but soon after they're gonna need to stop these meds and give something like tranexamic acid and vitamin K to stop the bleeding. Very tough condition to manage.
Nurse, help! I come with my arm!
Where was the bleed?
His brain. I've stopped the treatment and called a neurosurgeon.
A neurosurgeon for right arm paralysis? That's like using a sledgehammer to fit a light bulb. I say that for two main reasons: the location of the bleed and the patient's clotting status. Firstly, bleeds in the brain happen in many different places. There are 4 types: epidural, subdural, subarachnoid, and intracerebral hemorrhages. The first 3 of those are outside the brain and amenable to surgery, and the last is in the brain and is only rarely operated on, and for good reason, because it's actually a type of stroke, and that type of bleed is likely causing this patient's symptoms because of how localized his symptoms are. Just the right arm indicates that the bleed has affected an area of his primary motor cortex in the brain. That type of bleed, many studies have shown that removing the blood surgically in the early phase makes absolutely no difference to the patient's recovery and just puts the patient at risk from the surgical operation. But let's say, hypothetically, this patient did need the surgery. Their clotting would be so delicate without clotting factors that any cut you made to remove bleeding would just leak more blood. It'd be like trying to fill a bucket with a hole at the bottom, or chopping off a hydra's head and 2 more take its place. I would definitely want to check the heart in this patient for infective endocarditis, as it could be throwing off small clots that are leading to all of this. Such a curious case. I love it.
I can move it now.
The x-ray now shows lung infiltrates.
Lung infiltrates? Now that is a huge clue. Let's think about this for a second. He's a manual worker. We know he does a cleaning job, but we don't know where. His clotting was off, he wasn't breathing well, and now we know he has lung infiltrates, which means that there is an extra denser substance than air in there on his chest x-ray. What if during his cleaning job he works at a gold extraction center that uses mercury? I say mercury because it's a heavy metal that is highly toxic, can cause clotting abnormalities and chemical lung inflammations if it's inhaled. It's useful in extracting gold because it can form what Walter White would call a mercury gold amalgam, which you can then heat to evaporate the mercury and obtain the gold. Pretty cool if you've got protection. So I would definitely want to test the blood for mercury levels and the other heavy metals, I suppose, in case I'm wrong. If he has it, then chelation to remove some of the mercury from his system would definitely help. There was actually a case report of a 7-year-old boy who managed to get mercury poisoning from playing with batteries. He was unwell for months and nobody could figure out why with normal blood test results. Then they found the high mercury. Bit of a wild theory, but could work.
What if he was sick before he had his run-in with gravity?
I'm not breaking into my boss's house.
I'm coming with.
Beautiful. It's fuzzy. It's black. It's alive.
Now the story is closed with House's ex Stacy. Seems like he's got a new flame, Cuddy. Now he's gonna show his appreciation by breaking into her house, all while Cuddy and Cameron are breaking into Alfredo's house and nobody's in the hospital looking after the patient. You kind of start to understand Vogler's point when he was confused why they have one patient every week. This is why. Who would look after the second patient while the whole team are out playing Cluedo? Cuddy found rats. Could be an indicator of leptospirosis potentially, but that would be a bit too easy. Seems like House's crew found black mold under the sink, which could be causing hypersensitivity pneumonitis leading to the infiltrates, or he just has black mold like 2/3 of the people in the UK who have claimed to have an issue with mold at some point. This is sadly much higher in privately rented properties compared to owner-occupied places. Usually it indicates a ventilation and humidity problem and you can fix it with a mold killer, but it will keep coming back until the underlying cause is fixed, like adding a damp-proof course or an air brick for ventilation, for example. These are expensive and the sad reality is landlords would rather not shell out for it if it won't change how much rent they'll earn. That and the air pollution in London makes it no surprise that we suffer from so many preventable asthma deaths in London. For the first time ever in 2020 in London, the coroner ruled that air pollution was a cause of a 9-year-old's death while she was living in London. Hopefully steps like that will help us to keep improving the air quality. Even though New York is twice as densely populated as London, it actually has lower levels of air pollution. Crazy. Now, if you think this channel is a breath of fresh air, then check out the channel membership. You get access to special perks like priority reply to comments, being able to suggest a series and episode for me to react to, and early access to new videos. For a limited time only, the first 30 people will get a chance to win a 1-hour, one-on-one summer mindbender medical tutor session with me on a topic of your choice. We currently have 22 members, meaning that there are only 8 spots left, filling quickly, so join now to secure your place before it's too late. The earlier you join, the earlier I can react to your suggestions, so press join now.
Patient's lung functions declining rapidly.
He has streptobacillus.
Bite fever.
Certainly one possibility. But what about the aspergillus fungus we found under the sink?
You're right. The focal consolidation makes fungal pneumonia far more likely.
Fungal pneumonia. Now that's a diagnosis you don't hear very often. People can get this through inhaled spores of fungus. A spore is like a shell state which makes the fungus hard to kill, but unfortunately still alive. Kind of like Boris Johnson's political career. Once the fungus is inside the body, it can convert into a yeast state, which can be called a mycelium. It leads the fungus to start replicating more aggressively and become a multicellular version, which is then known as a mold. Usually in humans, this type of respiratory infection is a slow onset pneumonia and isn't severe unless the patient is immunocompromised. If it gets severe, then the fungus can spread throughout the body, causing disseminated fungal infection, which can be fatal. There are many different types which each have unique characteristics, like a verrucous wart in blastomyces or erythema nodosum with coccidioidomycosis, a pirate wheel appearance with paracoccidioidomycosis. You would then confirm with a sputum sample and antibody tests, and the treatment would be with fluconazole or itraconazole if it's localized and amphotericin B if disseminated. Question for you smart people. Are fungal pneumonias contagious? Answers down below.
The treatment for aspergillosis is amphotericin. That's hugely dangerous.
Start him on the Infiltrative.
I'm not buying into no racist drug, okay?
It's racist because it helps black people more than white people?
Earlier in this episode, Foreman spoke about how black people are more likely to be deficient of a molecule called nitric oxide. So this medication he wanted to give combines a nitrate with a blood pressure pill, which was targeted to African Americans as they tend to have nitric oxide deficiencies. The truth is that we don't use nitric oxide at all in the management of high blood pressure now, and it was an exciting new drug target at the turn of the century, but trial data didn't quite measure up. That being said though, according to best practice guidelines, we treat African Americans with high blood pressure differently to all other ethnicities. That means the usual first-line drug for under 55s called ramipril, which targets this enzyme, doesn't work as well. So these patients are given a different medication called amlodipine first. Other ethnic differences are that African Americans have higher rates of prostate cancer due to high testosterone levels, low uptake of vaccines, which is also reflected across other ethnic minorities, also high rates of heart disease, stroke, cancer, asthma, pneumonia, diabetes, and HIV. A huge public health focus at the moment is to try and reduce these ethnic differences as much as practically possible.
See another doctor.
Fine. I'll give you the same medicine we give Republicans.
He hasn't peed since yesterday.
I think he's dying.
It wasn't aspergillus. And it's starting to rot.
House's communication teacher in med school must be proud. This patient is trying his hardest to get discharged while his hand is rotting though. I want to say he's making a stupid decision, but I'd probably do the same. The average insured hospital stay in the US in a specialist unit costs $14,900 per night. Interestingly, if I lost an arm when I went skydiving recently, I would have gotten a massive payout of $14,000. So according to insurance companies, my arm isn't even worth one night in hospital. Interestingly, insurance values both arms the same as well, but who can put a value on years of unilateral wrist training? So how are we going to save this guy's hand? We know he has low sodium, was breathless, has rats at home, is Mexican, wants to leave hospital. What if he's from southern Mexico and has tuberculosis? That could cause the breathlessness, the fever, it can cause finger ischemia, and is very difficult to diagnose unless you're specifically looking for it. Cultures would all come back negative. Maybe the rats show that he's living in overcrowded or unhygienic conditions that make tuberculosis more common. Getting a sputum culture and using a Zeal-Nelson stain would be good, and you could do a quick blood test to give a preliminary indication called a quantiferon as well. If he's positive, then we could even save that valuable right hand.
His hand still has an arterial pulse.
His hand is a cesspool and the crap is spreading.
He loses that hand, he loses his job.
You sure I need to do this?
Yes.
What? He's actually gonna lose his hand? Okay, let's think about this. The patient started thinking he had asthma. He now has multi-system involvement, high temperature. Yes, it could still be TB, but autoimmune still fits really well. What about eosinophilic granulomatosis with polyangiitis? That can cause kidney failure and low sodium, the changing color of the fingers. It's no longer called Churg-Strauss, and some people say it's because the doctors who discovered the condition were Nazis, but that couldn't be further from the truth. Dr. Churg was actually a Polish Jew who immigrated to the US in 1936. Dr. Strauss was ethnically German, but completed med school in Italy in 1937 and emigrated to the US in 1938. It was renamed to try and achieve consistency in naming with other related vasculitides like microscopic polyangiitis and granulomatosis with polyangiitis. The classic test for it is an antibody called P-Anchor. It does explain everything. Treatment would be steroids that would fix him up. Come on, they have to get this.
Give one of my clinic patients a follow-up call. He said you gave him the white folk stuff.
I told him it was the white stuff, I gave him the black stuff.
Oh, House, I know you mean well, but getting a patient to go along with your suggestion by lying to them is never a true victory. It sure is fun to watch though. There have been so many times where I've had patients who were making what I thought was a very unwise decision. One that stands out is a 53-year-old African female who we were called to by her neighbor because she was worried about the patient. When we got to her house, there were blood stains all over the sofa and chairs. She'd gone through the menopause 2 years earlier, but now had heavy vaginal bleeding constantly for the last 2 to 3 months. I examined her abdomen and it felt like there was a mass in the lower part, almost certainly coming from her womb considering the symptoms and the placement. She declined a vaginal examination and refused to go to hospital. I was the first doctor to see her in years because the lady had an extreme conviction in her faith as a spiritual leader. She mentioned that prayer will heal her from this and only God can find the solution for her. She had total capacity to understand what I was saying and make a decision for herself, albeit a very unwise decision. We went back frequently after and her decision was always the same. She did become unconscious eventually and was taken into hospital, but after being transfused, she declined any investigations and had to be discharged. I wonder what House would have said in that situation. Conveniently, I've just gotten off the phone to God and he'd like you to go to hospital, have an ultrasound and let us cut out your womb because, trust him, you really don't need it anymore. Job done. Yeah, I didn't do that.
Right, I'm a racist.
Every slave master thought they were doing the black man a favor. Stop doing us favors. If you're right and we end up back in the jungle with lousy blood pressure medicine, it won't be on your head.
Oh, what a brilliant performance from Omar Epps, who plays Foreman there, and some very valid points made. This reminds me of a book I read recently that changed my life called The Courage to be Disliked by Ichiro Kishimi. In it, he argues that all problems are interpersonal relationship problems, and one of the best ways to tackle that and achieve happiness is known as the separation of tasks. I have my tasks. You have your tasks. I can help you with your tasks if that help is welcomed, but I can't make you do tasks. I've applied this to almost every area of life, being a doctor, a husband, doing house chores, and being a dad. If you want to hear more, then you can get the book for free by signing up to Audible Premium Plus using the link in the description. You do help to support the channel by doing that, as I do get a small kickback. Thank you.
I've wanted to be a doctor from the time I was 12. Chief of medicine at 32. I would have watched him die, trying to save his hand.
This is one of the hardest parts of medicine, living with the decisions you make. Many doctors carry around significant guilt with them about cancers they missed or patients they could have saved if they did things differently. I've been lucky enough to have avoided any of those in my short 6 years as a doctor, but dealing with those situations can be very tough, especially when it's the system that lets you down and not something that you could have changed. One thing to point out is that in this series, they can get any scan, anytime, without a problem. They need to do it that way, as it wouldn't be entertaining watching our patient wait in a queue for 40 minutes, have the scan, and then be told that we'll get the results in a week. One of my colleagues recently saw a 38-year-old female patient with extreme back pain, which was worse on lying down. We call that symptom a red flag in back pain because it could indicate a serious underlying pathology. So he ordered an urgent MRI scan, which was rejected by the department because they wanted the patient to do physio first for 6 weeks. That process wasted 2 weeks. He decided that was total horse poop and sent her to the 2-week wait specialist clinic instead, who did an MRI on the same day and found a massive spinal tumor, and they operated on it a week later. In cancer, every week makes a difference. We fed that back to the department, who rejected it, but will they change their protocol? Who knows?
House is right. I haven't been a doctor in years.
His little finger's dusky. On me, on the other hand.
O2 sats are down to 88. It's a ventilator.
Endocarditis.
Yes! Wow, I got that one very early. They sure managed to misdirect me well, though, across the whole series with the rats and the fungal pneumonia. So What made me think of endocarditis in the first place? If he's a manual worker, struggling to get by financially, not looking after his teeth so well, then bacteria like Staph aureus or streptococci could enter his system through his gums into the bloodstream. They then camp out on the patient's heart valve and send off parcels of bacteria mixed with blood clots to the rest of the body. That could be the fingers, the brain, the bowel, or the feet. Now, we know to suspect this because when we admit a patient, we always listen to the heart, and these patients almost always have a heart murmur. Fever and new murmur automatically makes us suspect endocarditis and get a jelly scan of the heart called an echo. There are some typical signs of this that you don't always get, like Janeway lesions, Osler's nodes, splinter hemorrhages of the fingernails. Treatment is with IV antibiotics for 6 weeks and then replacing the seeded or infected heart valve. I've assisted in those operations before when I was on cardiothoracics. They can take an average of 4 to 5 hours to do. Now, save that man's fingers.
Little bacteria cauliflowers clinging to his valves.
We already tested for endocarditis and he was negative.
What infection could cause pneumonia and culture-negative endocarditis?
Interesting. So it seems like Cuddy's getting at the idea that the patient had a series of blood culture tests. That's when we take special bottles of blood that allow bacteria to grow, and these patients were negative. That definitely doesn't mean the patient won't have endocarditis, as there are some slow-growing organisms that cause endocarditis that you wouldn't detect in this way. We call them fastidious organisms, and it includes things like Mycoplasma, Chlamydia, Bartonella, Q fever, Legionella. My top bet here would be Mycoplasma because of the pneumonia, the low sodium, potentially being in crowded conditions, or Q fever caused by Coxiella burnetii. Fits the earlier egg theory and Humpty Dumpty storyline better, but not necessarily the symptoms, though. I'm itching to find out.
You're thinking psittacosis?
Give him doxycycline.
Your asthma made you vulnerable.
Psittacosis! Damn, I like my Humpty Dumpty theory, but moonlighting at the cockfighting ring is pretty good too. So what is psittacosis? It's what we call a zoonotic disease, which means it transmits from animals to humans. So usually it's domestic birds that can get infected with the bacteria Chlamydia psittaci. That is very different to the chlamydia you're thinking of, which would be a very different type of cockfight. Typically it's parrots that cause psittacosis, but it can be poultry as well. Diagnosis would be with a blood test or sputum culture, and treatment is with doxycycline, which the patient already has. Surprisingly good episode. I'd say 7 out of 10 entertainment, 8 out of 10 accuracy, 7.5 out of 10 diagnosis.
You're gonna be all right now.
Gracias, saving my life.
Your guilt makes you a crappy doctor. It also makes you okay at what you do. You're not happy unless things are just right.
Oh, very interesting point, House. Cuddy is a giant perfectionist, and that's probably why she has accomplished so much. House's point is that needing perfection to be happy means that, yes, she gets results, but she will never be happy. Is that true, though? Can you want things to be as good as they can be and still enjoy the journey? I definitely think so. House is right, though, that some personality types are much more goal-oriented and forget to enjoy the journey. On the Myers-Briggs scale, we say that those are more thinking rather than feeling types in the third domain, which are more likely to be men. No wonder why my wife needs to drag me off my laptop sometimes. Also, seems like this House-Cuddy relationship is heating up and everyone thinks that they're sleeping together. This episode was good, but makes way more sense when you watch the previous one where House performs an autopsy on a living girl. Watch that here now.